It's a go-to painkiller. Oxycodone combines oxycodone and acetaminophen into one pill. For many people, it's what keeps their pain in check. But right now, it's getting hard to come by. Health Canada warning of a national shortage, and pharmacists like Tim Brady are feeling the pressure.
It's scary. If you've been stabilized, you have chronic pain, you found medications that are working for you, then all of a sudden you come to the pharmacy and say we have none. You don't want to go back into that situation again.
A manufacturing issue combined with rising demand has triggered a supply crunch with no full doses left. Brady's making tough calls, limiting refills, splitting doses, and trying to help as many customers as possible with what little stock remains.
We're basically out now. We're hoping that we'll get some in again soon. You're trying to limit people to like 30-day supplies instead of 3 months, trying to make sure we can, spread it around so everybody gets some.
The warning from Health Canada came in mid-July, but pharmacists like Brady say the squeeze started weeks before that as shelves slowly emptied. At Windsor Regional Hospital, staff saw it coming too and started planning early.
We look at our stock levels, then we'll determine basically a date of when we anticipate that we're going to run out, and then we'll start working on a plan. We're going to start to restrict it to those patients and use alternatives for other patients.
Drug shortages are nothing new. Canada sees hundreds of them every year, but it is rare for such a common pill to be impacted. Experts say the global supply chain is fragile, and even a small hiccup can cause a big problem.
For one pill to end up in your vial, it probably has ingredients from multiple countries. It's gone through maybe 8, 9 different factories. And so if something along that chain happens, you start to see a domino effect.
Health Canada says it's working with manufacturers to manage the shortage, calling drug access a top priority. Supply could return in the coming weeks.
When you have a drug that what we call is a fast mover, it's a commonly used medication, you also have people who are newly starting on it, but you have some patients who are on it for a long period of time. You're faced with a scenario where you have to make tough choices.
Brady says his team is doing everything they can, but the best thing customers can do is check in early and be patient.
It's not that we're trying to deny you the medications. We're not trying to make your life difficult. It's just we can't get any.
Health Canada tells CTV News this shortage is only supposed to last until early August. Until then, the advice from experts and pharmacists alike, don't panic, but plan ahead. Stephanie.
Okay, good to know. Travis Fortnum tonight. Thank you for this.